Welcome back to Studio 10, helping people stay active and injury-free. That's the goal of the sports medicine team at the USA Family Medicine and Accordia Health Partnership Clinic. We've talked before about how this collaboration is bringing many different specialties together under one roof. And today we have Dr. Sarah McMullin joining us to share more about the sports medicine services that she has to offer. It's good to see you.
Yeah, nice to see you
Yeah,
too.
so happy to have you here on the show this morning. So let's talk about sports medicine specifically. It covers a wide range of parents from kids to adults. Who do you typically see in service?
So I see all age ranges. So I think the youngest I've seen in sports medicine is about 3, oldest into the 90s. And we take care of athletes and non-athletes alike.
Yeah, so let's talk about some of the common conditions that you typically see with some of the younger athletes. For parents watching this morning and they've got their kids in sports, any kind of sport, what should they know?
Yeah, so most common athletic injury would be an ankle sprain. We also see lots of knee ligament injuries. I would say even though these things are common, though, it doesn't mean that they're not serious and not important. So having your child seen when they have an injury kind of right away helps them to get better faster, get into the rehab that they need, get into the treatment so they can get back out to doing what they love. But then it also helps prevent them from having it happen again.
Yeah, definitely good to know as a parent out there. We've got a lot of dancers here on the Gulf Coast here and everywhere. I understand that you actually have some expertise working with this specific sport in New York. What's your backstory in that?
Yeah, so I grew up figure skating and doing dance, so I've always had kind of an interest in that performing arts. And then as part of my fellowship at New York City, I worked at the Harkness Center for Dance Medicine, and it's a center that just sees dancers of any level. And so I've tried to bring that to Mobile because that was kind of an unfilled need here. So I've been working with the Mobile Ballet as well as lots of other company dancers and recreational dancers as well.
Yeah, so awesome to have someone like you here on the Gulf Coast helping our dancers and those who teach dance as well. For those of us who wouldn't consider ourselves athletes anymore, adults who are just trying to live day by day, why do you think that adults here on the Gulf Coast and everywhere should strive to be more active every single week?
So we can, in sports medicine, see all types of patients. When we see patients that are not athletes, we think about the goal to get them back to doing what they enjoy in their life, whatever that is. And we know that the most helpful things to keep people moving are just maintaining physical activity. And that should include like about 150 minutes a week of some aerobic exercise, but also like strength training, because that helps stabilize joints and prevent injuries too.
Yeah, so a few things to remember as you go throughout your week. We're taking a look at the facility now on your screen. If people are watching this morning and they want to make an appointment with you or want to keep you in mind if their young athlete has any kind of injury in the near or far future, how can we do that?
So yeah, happy to see your young athlete or yourself. They just have to call our clinic to make an appointment. They don't need a referral and just ask for a sports medicine appointment.
All right, well, Dr. McMullin, thank you so much for being with us today. And we will have more information on our website about this partnership, specifically about sports medicine in our conversation this morning. That'll be at fox10tv.com. We hope you have a great weekend.
Great, thank you.
Let's go ahead and get a check of that weekend.